Doctors from Stanford Hospital in Connecticut don't just accept the rising dangers of childhood obesity, they're doing something about it. Last week, hundreds of educators and health officials came out to support the fight in a conference titled Changing the Community, a Symposium on Childhood Obesity. Keynote speaker Dr. William Deet says combating the problem starts with the community, not the government.
When you look at other social movements, almost none were top-down. I can't think of any that were top-down. They've all been bottom-up and dependent on grassroots support and the perception of a common threat.
He says steps like cutting down on sweets and sugary drinks are some of the first steps to shedding the pounds. Limiting TV time and technology follows. But he says technology could be useful to fight obesity.
I do think technology has a potential role with respect to obesity. One of the first things that we're seeing is that online weight loss strategies with active feedback to patients. And that seems to be working. The study, there's been a meta-analysis of that which showed that it was promising. They didn't conclude that it was effective because the study designs were compromised. But with respect to the ad marketing to children, I would love to have someone develop something like the V-chip. And the V-chip for televisions blocks violent programming. I'd love to see an A-chip which blocks advertising directed at children.
Last week's conference brought out several speakers, including Stanford's very own Dr. Mather, who runs a program called Kids Fans, one with a clear 5210 message, 5 servings of fruits and vegetables, 2 hours max of screen time, 1 hour of moderate physical activity, and 0 sugary drinks. Kids who complete the program leave healthier. But it hasn't been without challenge.
Parents bring the child to you and they expect that you'll teach them and the kids can do it on their own. And that's not true. So when the parents are having an ice cream or if they have soda in the house and they tell the child, but you're overweight, you shouldn't be having it, and the little one who's not overweight can have it, it's such unrealistic expectations, and that's what I find most difficult. So parents would like the child to be healthy, but then they're not ready to walk the walk.
She says in some cases, it's hard for families to sustain the change once they finish the program, an issue that they are working to resolve.
I have many families who've really taken it to heart, who started with baby steps and then just flipped totally and have become wonderful. If I can empower someone to say that they can do it, I think I've done my job.
That's the latest from the American Council on Science and Health.